11 signs of cancer often ignored by women. How's it going, Hapthies? Today we will talk about some information that may one day help you save a life, be it yours or someone you know. Cancer is a taboo subject in a way that no one wants to think they or someone they care about could fall victim to it, and for good reason. It's an unrelenting disease that devastates lives and families alike. It is something that you may not have thought about, especially if you seem young and healthy, but the fact of the matter is, our bodies are constantly changing, and this is especially true for women. While a human body changes many times during a person's life, some of the biggest changes that occur in women happen after menopause, and this is also when the most common kinds of cancer in women can appear. Once cancer gets a hold of the human body, if left untreated, it can spread at a rapid pace, making recovery all but impossible. But the good news is, if identified early, with proper treatments, it is possible to make a full recovery. It's extremely important for women of all ages to possess the knowledge and read the signs their bodies are providing them with before it's too late. So let's talk about some of these indications that you must watch out for when it comes to cancer. Also, stick around for a bonus fact at the end that may help you identify your likelihood of getting cancer. Changes in the breasts. In a very high number of instances, breast cancer in women displays such obvious physical changes to the chest area that it is usually self-diagnosed by women during everyday activities like bathing, shaving, or scratching. There are several early warning signs that you should be cautious about in regards to breast cancer. While not every lump is cancerous, it is important to give yourself a monthly breast exam and consult your doctor if a lump doesn't go away after some time. If you have swelling around your armpit or collarbone area, this could be a major indication that cancer has spread to the lymph nodes. Sometimes, the swelling may appear before a lump, so it's wise to advise your doctor accordingly. Although pain and tenderness are rarely the first symptoms that appear, it is still a good idea to ask your doctor. The most telltale signs of breast cancer arise when the breasts undergo physical changes. These can include a difference in size, color, or texture of your skin. There may also be a flat or indented area on the breast. Some changes in the nipple may occur, like them turning inwards, getting dimpled, burning, or itching. Unusual nipple discharge may also occur that can be bloody, clear, or even yellow. Bloating. While lots of things can cause bloating in women, like eating a carb-rich meal or when going through hormonal changes during the menstrual cycle, usually natural bloating only lasts a day or two. But if you notice that it doesn't go away for over a week or more and is accompanied by other unexplainable signs like weight loss and bleeding, it may be an early sign of ovarian cancer. Some other signs of ovarian cancer include sudden lack of energy, feeling sated quickly after having a meal, problems eating, and a constant need to urinate. These symptoms are often overlooked by women, and this makes ovarian cancer one of the most elusive when it comes to a timely diagnosis. It is highly encouraged to seek out medical advice if you suffer from long periods of bloating. Bleeding between periods. While bleeding during your menstrual cycle is completely natural, spotting outside of it can be a cause of concern. Endometrial cancer affects the lining of the uterus and can cause this sort of abnormal bleeding. If you experience bleeding before your menstrual cycle starts or during intercourse, it can be an indication of cervical or vaginal cancer. Blood in the urine or stool. While it's true that blood in the urine or stool is mostly caused by hemorrhoids, but if it remains over 2 days, it could be a sign of something more sinister. Stool color tends to vary depending on factors like your diet and medication, but if you have black-colored stools, it could be a sign of multiple illnesses, such as bleeding in your upper gastrointestinal tract, diverticulitis, or even colon cancer. Lymph node changes. Lymph nodes are an essential part of the body's immune system. They are tiny tissue found all over the body, which helps the body filter harmful and remove harmful fluids and cells from the body. This includes all sorts of viruses and bacteria, as well as cancerous substances. As the lymph nodes try to filter out cancerous cells, this can cause them to accumulate around the area, causing the nodes to swell and become infected. This is a very advanced stage of cancer that is often life-threatening, so a doctor must be consulted if any changes to the lymph nodes are observed. Neck, groin, and underarms are some of the most common hotspots where inflammation may occur, and they feel like tiny, firm lumps that are tender to the touch. Trouble swallowing. While even the common flu can cause a loss of appetite and trouble swallowing and drinking, if it is persistent and is followed by unexplained weight loss or even occasional vomiting, it can be a disturbing sign of thyroid, lung, or stomach cancer. A feeling of having food stuck in the throat or even choking on food can happen. These symptoms can get worse over time and may point towards the growth of cancer, making the esophagus narrower. Changes in the nails. Changes in the shape and color of nails can sometimes be a sign of melanoma. It is important to look out for a dark streak on the nail, especially one that is changing or growing, as this could mean the cancer is spreading. Dark areas under the cuticle of the nail may look like small bruises along the bottom edge of the nail. Sometimes there may be small cracks or tears on the nails or fingertips that are often painful and even bleed at times, causing splinter hemorrhages. Some other notable changes that may occur due to melanoma include hyperpigmentation, inflammation, or even complete nail loss. Unexpected weight loss. While our bodies are constantly evolving and our weight can fluctuate with our eating habits, doctors recommend that if you lose more than 5% of your total body weight in 6 months to a year unexpectedly, it may be because of a serious illness. While heavy stress can cause weight loss, but so can pancreatic and colon cancer. Statistically, 50% of all people suffering from esophageal cancer also experience weight loss, probably due to swallowing problems. A sudden loss of 10 pounds or more is often the first sign of many kinds of cancer. According to a study done by the Cancer Research UK, 80% of people who suffer from pancreatic cancer, esophageal cancer, or stomach cancer have all reported considerable weight loss before they were even diagnosed. Similarly, 60% of all people suffering from lung cancer have also reported the same type of unexpected weight loss before their diagnosis. Heartburn. If you observe that you have heartburn, but it's proving difficult to kick, even after adequate rest and treatment, it may be a sign of cancer. Some types of cancer can cause heartburn when the contents of the stomach come back up in the esophagus, triggering acid reflux and causing a burning sensation in the chest and throat. If this condition persists, it may develop into Barrett's esophagus, which increases the risk of throat cancer even more. It may help to document the foods that are most likely to cause heartburn, creating a smarter meal plan for you to avoid unnecessary heartburn. Changes of the mouth. Often, the first sign of oral cancer is a growth or sore in the mouth that doesn't go away. This cancer can appear in a number of places and forms, such as on the tongue, below the tongue, lips, palate, throat, cheeks, and sinuses. Some of the changes that occur due to cancer causes in the mouth are swelling, erosion, or rough spots, including lumps around the lips, gums, and other areas of the mouth. White, red, and speckled spots may appear, followed by unexplained bleeding. Sores that bleed easily and don't heal after 2 weeks are also a sign, along with the feeling of having food stuck in the throat and difficulty chewing and swallowing. Chronic cough. If you have a chronic cough that hasn't gone away for over 4 weeks, and if you are a smoker, it is very possible that you could have lung cancer. It is important to look out for signs of blood or excess mucus if you have chronic cough. If your cough sounds deeper or hoarse, it may be an indication that it's time to get checked. Chronic coughing brought on by lung cancer usually follows with other infections like bronchitis and pneumonia, and also causes shortness of breath and chest pains. Bonus fact. So it's finally time for that bonus fact we promised you earlier, and it could help you assess your risk of cancer. What you may not have known is that cancer can be a hereditary disease that may be inherited through family genes. Cancer occurs when mutations occur in the genes that control our body's growth and division of cells, preventing them to function properly. We as humans receive 2 complete copies of genes, one from each parent. It is estimated that 10 to 5% of all cancers are hereditary. In these cases, a genetic copy from one of the parents comes with a mutation in the growth control gene. This mutated gene is therefore present in each cell of the body, but a working copy inherited from the other parent usually ends up suppressing the mutated gene. But if the working gene is damaged in any way, it ends up becoming cancerous. This is the reason why people who inherit cancerous genes from their parents are more likely to develop certain cancers in their lifetimes. Often we as humans fail to give importance to the signs our bodies provide us, which lead to disastrous consequences for us and our families. Symptoms that seem insignificant can be caused by something so malicious and frightening, but paying attention to them can turn a story of illness and disease into that kind of survival and strength. So please listen to your body, see a doctor often, take care of yourself, and always stay Hapthy.